Good afternoon, everyone. Thank you again for joining us here on Facebook Live for our afternoon update. We have an incredible guest this afternoon that is going to enlighten and inform us like nobody else. So before we get to the guests, I want to give our update. We currently have 819 total cases in Hillsborough County, including 17 deaths. And as I say every day, never forget that there is an individual representing each of those numbers, and that was someone's child, mother, father, brother, sister. So we are doing everything that we can to ensure that not only do we reduce the number of positive cases, but we make sure that we keep those deaths as low as we possibly can. And that's going to take all of our efforts. In Florida, we have 21,367 total cases, positive cases, with 524 deaths. Now in Hillsborough County, as I said yesterday, we're starting to get those testing results back in mass. And so we're going to see those numbers jump up, but hopefully we won't see the deaths increase. And again, we can all flatten that curve by physical distancing and washing our hands for 20 seconds and taking those simple steps to disinfect areas, but staying away from other individuals 6 foot or more, and also wearing face coverings. We talked about this at the emergency policy group yesterday, and we're looking at socializing that idea throughout the community. In other words, letting everyone know the significance of that. There are really two undisputed steps that can be taken that will stop the transmission of this virus, and that is the distance separation, and the other one is facial covering. So that's something that we want everybody to do when you're out in the public, when you're encountering other individuals going into the grocery stores, wherever it is that you may encounter others. Just try to cover your face. And you can go from elaborate homemade face coverings all the way to using your t-shirt and pulling that up over and anything in between. We ask that citizens don't use the N95 masks because those are in short supply, and we're trying to save those for our health professionals. So again, if you can wear face covering, stay 6 foot apart, and stay inside whenever possible, please. Now, we also yesterday, we talked at the EPG about some of the gatherings that are going on in our community where we have young people specifically that are still gathering in groups. And as we have all heard, quite often this virus can be silent. It's easily transmitted, and then it can be silent, meaning you can be asymptomatic and taking it back into the home, passing it to those that can least afford to get this virus. So as a result, we voted the emergency policy group to put a nighttime curfew in place, and you still have the ability to go out and do whatever you have to do. If you have to go to the pharmacy, if you have to go to and from work, you're an essential worker. If there are things that you must be out and about doing, you can do that. What we're trying to do is to get everyone to stay inside when possible. And I like to explain these things in the simplest of terms. So with that curfew, we shouldn't even get to enforcement. Nobody should have to ask about that if you're doing the right thing. All boils down to personal responsibility. So be home at 9 o'clock at night. If you don't have to go back outside, do not go outside. And if you do have to go to work or to the pharmacy or someplace as an emergency, make sure that you're wearing the face covering and staying 6 feet away. So very simple. It's not a draconian step that some are making this out to be. It is just an attempt to get individuals to stay inside, stay away from each other. So very, very simple. On a lighter note, and my son told me that I have to make a TikTok video, so if that ever makes the airwaves, you guys will certainly have another thing to laugh about here during this difficult time. But don't forget about our dance party. It is 6 o'clock every night. Our great partnership with iHeartRadio and our 6 radio stations, 93.3 FLZ, Mix 100.7, 95.7 The Beat, Roomba 106.5, 98 Rock, and US 103.5. Every day you can go on any of these sites and you can vote for the song of the day. And 6 o'clock at night, they play the same song on all 6 of the radio stations. And remember to go outside, wave at your neighbors, keep 6 foot apart, and dance like nobody's watching. So it's a time for us to come together as a community, and it's a time to let off a little bit of that stress and that frustration, and for us all to just have a good time for a few minutes. Now today, one more announcement. We announced One Tampa, and that is One Tampa, Relief Now, Rise Together. And what we are doing is providing relief for our residents and also for our small businesses. So you can go on to onetampa.org and you can see all of the details of that. What this program does is take care of a month's rent or mortgage and utilities. And it's open to all individuals throughout the city of Tampa, as long as you're a resident of the city of Tampa. And then it's available for small businesses that are in the low-income census tract or part of a community revitalization area, better known as CRAs. And that covers a large part of our community. What we're looking to do is to provide immediate funding for so many of our citizens that are really in dire straits, you know, having lost jobs or had income reduced. And we're trying to help out in that period until the federal and state funding becomes available. So you can go to onetampa.org, see all of the details on there for qualification. Our aspirational goal is $8 million to be able to provide to our citizens and our small businesses in the city of Tampa who are really suffering financially at this time. So doing what we can to try to reduce some of the burden and some of the stress. We also are encouraging those out in our community that have not been affected in any way by the virus financially or health-wise either, to step up and help out your neighbor. Step up and contribute to One Tampa and help those in need in our community. You've seen so many organizations that have been here on this program that are doing everything they can every single day to provide food, shelter, and any other need that our citizens may have. So please, please, please be one of those individuals that steps up and is part of the solution. We're doing this in partnership with the Crisis Center and Crisis Center of Tampa Bay and Tampa Bay Chamber of Commerce, and they have just been absolutely wonderful, as has the city staff that put this program together. So a lot of late nights that they were up making sure that we got this program together and out there available for our citizens and those small businesses that are in need. All right, so now let's get on to our guest, Dr. Judette Louis, and she is incredible. I said earlier, I said, my gosh, is that all you do? Let me get back to your credentials. Although she did correct me and tell me that it had to do, all of her specialties had to do with pregnant women. But she is the chair of the Department of Obstetrics and Gynecology at the Morsani School of Medicine at USF. But I don't know what I did with it. But what are all of the other, the immunology, gosh, what were all the other ones?
Well, I specialize in high-risk obstetrics, so I
Okay.
take care of women who have cardiovascular disease, endocrine disorders, and infectious diseases also.
Wow, that's incredible. Well, we're glad to have you in our community, that's for sure. So thank you for all you do, and I know that you have been very, very busy. So bottom line, I have a couple of friends that are getting ready to deliver, and one of which is high-risk pregnancy. So pregnant women are scared during this time, there's no doubt about it. So what should they know about the coronavirus?
Yeah, I agree. It's scary times for everyone, but particularly for women who are thinking about not only themselves but their babies. The first thing they need to know is that just by being pregnant itself does not make you more likely to get infected with coronavirus. And the other thing that we're starting to see as more places around the country are publishing their outcomes with these pregnancies, we're seeing that what you see in the general population is basically what you're seeing in pregnant women, that the vast majority of them will have a mild disease. There is a small portion of the population that will get very sick from it, but most of them will have mild disease. And that's important because that's different than some of these other viruses we've seen in the past, like the H1N1, you know, in the past where women who were pregnant were more severely affected. And so again, we would prefer that women didn't get coronavirus, but if you are going to get coronavirus, we're reassured by the fact that it's not worse than you would expect in the general population.
Okay, and no long-term effects that we know. I know it's early on the babies.
Yeah, so far there have been only a couple of reports where there's some evidence that the baby may have caught coronavirus at some point. What we don't know is whether they caught the coronavirus while inside the uterus or if it was during the birthing process that the babies caught it or afterwards. And so we're still investigating those scenarios.
Now, there are reports of individuals that are avoiding going to the hospitals because they feel that you know, that's where COVID-19 is most concentrated. How are hospitals protecting patients from contracting COVID-19?
I have to say, I have never been more proud of the healthcare system than right now. During this epidemic, this pandemic, we have seen the hospitals really step up and be very savvy about what they're doing. And so, you know, the hospital systems here in Tampa are working with each other, you know, collaboratively. They are sharing information, sharing resources. They're collectively being very aggressive about testing people because that's how you protect the population. Is you have to first identify who has the virus. Once we identify them, then also we are protecting those who aren't infected from getting infected by having dedicated teams to take care of the people who do have the coronavirus infection and setting up special units so that they get their care in one area of the hospital with a skilled team that then avoids cross-infection with others. And so, so I feel very comfortable saying that going into a hospital, that they are doing all they can to protect anybody else who does not have the infection already. So with everyone being afraid, if you are sick enough to go to a hospital, please don't ignore your symptoms. Whether you're in labor or you're having a stroke, it's really important to go get the health care that you need.
Without a doubt. And I personally have worked with all three of the major hospitals here and am very, very proud of the way that they have all worked together, you know, from the levels that I've seen. Everyone has worked together at the remote testing site that we have at Raymond James. All teams from Advent, Baycare, and TGH, all working hand in hand. And as you said, sharing supplies and really coming together in the best interests of our community. And that's really what, you know, that's what all we can ask for, without a doubt. So there have been reports of increases in domestic violence. What can we do to help women?
You know, I think it's so important for us to understand that at times like this, when people are under more stress, they're home more, They may be losing their jobs. There's a lot of pressures, and so we do see an uptick in domestic violence. And so it's important that if you recognize that is going on in the lives of your friends or family members, to help them recognize this, and to also help them to seek the help that they need. Yes. Often they won't seek help the first time that you bring it up, but that you make sure that you're a safe space for them so that you can continue having those conversations.
And that is critically important for individuals to get involved. So often people, friends, family, don't want to get involved in individuals' personal relationships, but you see those signs and those symptoms, you need to offer help and point out where individuals can go for help. As you said, the kids are home, there's a lot of stress, a lot of people out of work in confined areas, and if you're pregnant, you've got those hormones running as well. So, there are a lot of stressors out there. So we have to make sure that that one, we are recognizing and talking about domestic violence, and then also letting individuals know where they can go for help. And we had Clara Reynolds, who runs the Crisis Center, and she was on our show a week or so ago, and she said that 211 at the Crisis Center, you can call 211 and they have every single social service at their fingertips. So they can get you in touch with the spring or any other resources that you may need. And sometimes you just need someone to talk to. There needs to be that objective viewpoint in there. So that's we need to do everything that we can to ensure that domestic violence does not increase. How has the pandemic affected healthcare, in your opinion?
Oh, lots of changes. I think if we take it from each perspective, from the patient perspective, we've had to reinvent what we do because now we had to practice social distancing but still take care of patients. And so you've seen a huge ramp up in the use of telehealth. We've also, from the healthcare worker perspective, we've had to figure out ways to keep the healthcare workers safe while allowing them to continue to take care of patients and to help people, which is often why they said they went into healthcare. I suspect that after this, we will be forever changed because we've had to change what we do in a short amount of time with a little bit of information to say whether it works or not, but it's forced us to be open about how we do things. And so I think we can't go back to the old way, that now we'll be more open-minded about how we see patients and also how we take care of each other.
And there's so many changes in everything that we do, because this is, every other emergency situation crisis that I've been involved in, you had some forewarning. You saw it coming.
This is not the hurricane.
Right. And or you had information at your fingertips once something did happen, say in my field, law enforcement. Here, I'm making decisions with about 10% of the information, but 100% of the responsibility.
Absolutely.
So it really is going to have some dramatic change in so many different areas that it's going to be very interesting. So with that said, it's highlighted the importance of public health measures. What do you think that we've learned? Do you have any ideas of what may change moving forward with healthcare in our country?
I think we kind of took our eye off the ball for a while. We weren't prepared for something like this, and I think that contributed to some of the, the disease toll that we saw, because in some ways we had a lead time that we squandered, where we could have been preparing, but we didn't, in part because we didn't understand how serious it was, or some people, right, didn't understand how serious it was and failed to act quickly. But then when we started acting, we saw some of our measures, so thank you for the for putting the orders in place, because that social distancing is part of why we're not seeing as high of a disease toll here in the Tampa Bay region. And the danger for patients is not just catching coronavirus, but also when your health systems are so overburdened that you can't even handle the cases that you have. And so by being proactive, and then along with some other factors that helped us, a younger demographic, things like that, I think we're doing better than we would have otherwise. And so I think all of those things, we will see in the coming weeks and months as the scientists put all of it together, that we will get new information about what worked and what didn't.
Yes.
And then we'll be reminded that, we need to pay attention to public health again, especially in these times where we're very global. And that diseases can spread very quickly because of that globalization. So again, globalization is something that brings a lot of gifts, but there's some detriment to it too.
I was on a call with a group of mayors from the U.S. Conference of Mayors, and Bill de Blasio from New York spoke, and then someone asked him and said, what's been the biggest surprise for you? And this was a couple weeks back, and he said, the sheer speed with which this virus spread. He said, I've never seen anything like that. Where one day, same thing, the mayor from Seattle, one day you're fine, and then the next day you're not. And so we were able to benefit by the experience of some of the other larger cities, more densely populated, that were just hit by a tidal wave, basically. But one of the things that I'm a data person. I always like to make decisions based on data, and that's really, I think, been the most frustrating for me is, that we've lost the testing aspect because we just don't have the availability to test people that we need to, and then we were also stayed with that set of questions that said, if you traveled to these countries, you have a fever, you're already sick. So we narrowed the parameters by which individuals could be tested. And then we didn't collect the information from that. Like even people that called in to be triaged, we should have written down all of that information so we could map out hotspots, at least neighborhoods where it looks like it was beginning to take hold. But anyway, hopefully the antibody testing, we can get that out en masse, and we can find out who has immunities, and we can get them back into to the workforce and back into healthcare, taking care of those that are high risk. So we've talked about this on our show. We talked about it with the emergency planning group, and another lesson we have learned from other communities around the nation, and individuals that I've talked to, the mayor from New Orleans, the mayor from Chicago, the mayor from LA, and that this virus has a disproportionate effect on those lower income neighborhoods, minority neighborhoods, where you may have multi-generational living conditions, and you may have those comorbidity at a higher rate in some of those homes. So what do you think that we can do about that issue, about that particular problem?
I think the solutions to that are greater and larger than what can be done acutely, right? Because it comes from longstanding structural inequalities in terms of who gets schooling, who gets employed into positions where working at home is an option, so that you don't have these communities disproportionately affected by people who are working in the service industry, who are traveling farther by public transportation to their jobs, and so then they're exposed more. Right. They are disproportionately living in areas where there are toxic chemicals, so they have more lung disease. There's lots of data about institutional and bias within our healthcare system, where when they have symptoms, we don't believe them, or we give them a different treatment than we would someone who is not in those communities. And I think individually what we can do today, healthcare workers can identify that we have these biases and try to address them within the care that we provide. We can try and let these populations know that they are at higher risk, so then they can take what measures that they can, understanding that they have one hand tied behind their backs when they're trying to prevent from getting infected. And so I think after this, again, a more structured investment in decreasing those inequalities is what we need to improve the health of these populations. Right now, it's too easy to say, well, they're sicker and they're dying because they have diabetes or asthma, without looking at all of the other things that come into play.
Yes, without a doubt. I have to give that an amen right there. I mean, it really is, because there are, just so many issues that are long-standing, and that's why the focus of my administration, I'm looking at housing affordability, workforce development, transportation, those three, other things along with that, but those three issues are just intertwined and really allow for upward mobility. And so there are a number of approaches that we're taking, have been taking, and will continue to. But in the short term, what we have been able to do here in Hillsborough County is to get away from that CDC questionnaire and say anyone who wants a test is able to come and get a test. And then also provide for transportation and look to provide the collection kits to those healthcare facilities that are in the low-income neighborhoods, so that there is that accessibility, at least to the testing. And then again, make sure that, as you and I discussed prior to going on this program, to ensure that the younger population that is invincible, probably won't feel the effects of this virus if they do get it, that they need to understand that significance of taking it back into the home, and understand that that can be a death sentence. And so we really all have to understand our level of personal responsibility in making sure that our community is as safe as we can. So do you think that there's any unique challenges that Hillsborough County has faced in response to this pandemic?
Yes, I think unlike some of the places where I've worked up north, Hillsborough County provides care not just for our county, but a lot of the people in the rural areas outside of Hillsborough come into Hillsborough for care. And so, I think it's presented such a challenge in how do you still provide that care for them, that specialized care that they look to Tampa General for, or, daycare. How do you provide that when a pandemic is going on? And so we've had to really employ the use of technology, but then also the fears that we know that the rural areas are less likely to have the resources that they need to deal with a pandemic. And so there's a lot of concern about a second wave coming on and hitting the rural areas. And so we just need to keep our eyes on that, and recognizing that they do still look to us for the critical care and the highly specialized care. And so we need to be prepared for that second wave.
Yeah, and do you anticipate, as we discussed earlier, Dr. Lockwood was on, and he talked about the modeling, and that from what he's seeing through the modeling for our area, as you said, we've been able to flatten that curve, and that there's a good possibility that we won't even see any surge capacity that will test the capacity of our hospitals. So I think that will be wonderful in and of itself.
Yeah, I agree with him, in that regards. And so I'm very hopeful and optimistic that we won't hit that. But also, if we hit it, like I said, I'm so confident in our preparedness. You know, one of the great things about, you know, my partner hospitals, Tampa General, is that they were very proactive and progressive. So as you mentioned, things like expanding who you test. You know, it was great to be able to say to them, I think we should expand who we test to people who are working in residential homes, people that, you know, who are at risk for needing a C-section. And they just said, okay. You know, and so I think leadership makes such a difference at times like this.
Yes, without a doubt.
Yeah.
And Dr. Lockwood also said that there will be a resurgence. He says in September or October, but it will be manageable.
I hope so.
I hope so too.
We'll hopefully be closer to a vaccine.
Yes.
We'll be savvier about who to target, because part of the problem is that the data is constantly changing, right? Who's at risk, you know, oh, it's this group. No, now it's this. And so we'll have more data. And so hopefully next time around we'll be more prepared.
Yeah. And that's another irritant, isn't it? Is when people use like a lack of data to come to conclusions. It's like, well, only these individuals are getting this. Well, that's because those are the only ones we're testing.
Well, you know, this was an area where that really irked healthcare workers, right? Because healthcare workers felt so vulnerable because they were seeing something different than what CDC was saying. And so it was, you know, it made them nervous, and they just needed people to listen to them.
Okay, and we all need to listen to everybody, that's for sure. Talk less, listen more.
Yeah.
So essential workers may be feeling vulnerable as well. How do you think that employers, what steps should employers take to protect their employees?
Yeah, I think the first thing is to be sensitive. I saw a study where they asked workers what they were most nervous about, and it was the things you would expect. They're worried about getting sick. They're worried about providing for their families. They're worried about not being able to handle a situation if they're in it. And so I think employers can be sensitive to that. Work really hard to provide protection where you can, whether it's the masks or in Publix we see the plexiglass. You know, really try to listen to your workers, and even if you think they're being a little bit outrageous. So as a chair, sometimes I think some of my people are being outrageous. I have to step back and remember they're just scared. They're scared like everyone else, and it just manifests in a different way. And so I think listening to your workers and seeing what ways you can provide them with protective equipment, and then support as much as you can.
Yeah, that's great advice. So if you have a friend who is a healthcare worker, how can you support them?
I think the first thing is listening to them, you know, sometimes, or just providing words of support may be enough. Being patient with them, same thing. If they act out, you know, it may be that they're scared, because these days going to work is very scary. And there was, in my 20 years of doing obstetrics, I've never been scared to go to work, but now we're scared to go to work. And so I think just understanding that. Other ways that you can support, you know, we're all homeschooling now, you know, so you know, so if you happen to be skilled in math, you know, call me. I need someone to tutor my kids, or you know, any ways that you can help them with, you know, tutoring even via Zoom, or some people are doing meals. I think any way that you can support them to take one thing off of their plate is helpful. But even words of encouragement are enough.
Yeah, just a text.
Yeah.
You know, send a
Text,
text to say thank you
Thinking
for
of
what
you.
you're doing.
Yeah.
Right. Because you think about individuals that, you know, that have this and are hospitalized, their families can't be there. And that's out of everything, that's really what just breaks my heart, is the idea that someone would die alone. And so the healthcare workers, you know, not only do they have to take care of the patient, but they have to, you know, they have to carry them through that process as if it were their family member. So tough times.
We're trying to make exceptions for, you know, end of life. You know, so at Tampa General, we do allow visitors for end of life, but otherwise restrict it. And so you're right, you know, it's an extra burden for the healthcare worker to help with, you know, FaceTime or, you know, or these apps, but that's what we're trying to do. It's not the same, but, you know, in these times, we have to keep everyone safe.
Right, without a doubt. But, you know, those kinds of things, I mean, that's just adds on to the stress of what you're doing already. So what changes do you foresee in healthcare after this pandemic?
You know, I like to break it down into different categories. So there's, for the patient, I would love to see that, yes, we have fully embraced telehealth. Currently I will see sometimes patients coming from Sebring all the way up to Tampa to see a healthcare provider, or coming from other parts of Florida. And so it'll be great if they don't need to make those trips, right?
Yeah.
For healthcare, for workers, period, I think it may be a win, because people who weren't open-minded to working at home
Yes.
Are now seeing that, okay, maybe it's not as bad as they thought. And so there may be some more flexibility that then results in better work-life harmony for a lot of people. So those are at least two changes that I'm very excited about seeing come about at the end of this.
Yeah, it will. It'll be very interesting to see what what changes come all the way around.
Yeah.
Like Zoom. I
Zoom.
didn't even know what Zoom was, and now I've done about 100 Zoom meetings. All right, so we have some social media questions. Gina G. must be pregnant because she has 3 questions. There appears to be conflicting information about transmission from mother to baby. Can mother pass along the virus to the baby?
Yeah, and that's what we don't know yet. What's promising is the fact that we've only heard of a few cases. And in those cases, what is strange is that the blood work didn't look the way that we would expect it, so we can't tell if it happened while the baby was in the uterus or after the baby was out. And so we don't know the answer to that yet, but we're overall promising that even in places like New York, where there's a heavy disease burden, we're not seeing reports of babies being infected.
Okay, so that's good news, Gina. That's very good news. Yeah. Can a breastfeeding mother pass the virus on to her child?
So from what we know is that the virus is passed through respiratory droplets, and so in theory, while the baby is breastfeeding, you could have respiratory droplets fall on the baby. The recommendations have gone back and forth. Currently, most places are saying, they prefer that you express the breast milk and feed the baby that way. If a mom truly wants to breastfeed, make sure you're wearing a mask and that you're being sure not to breathe directly in the direction where the droplets can get to the baby. Okay.
And short of getting your cell phone number, Gina wants to know where she can get up-to-date information about pregnancy and COVID-19.
So I know a lot of the area hospitals have put information, certainly on the USF OB-GYN department website. We have a frequently asked questions sheet. You can also go to Mother to Baby and Baby Center are organizations that I've worked with to get information for patients out there. Yeah.
Well, congratulations, Gina. I'm sure you're going to have a healthy and happy baby and send us photographs. Okay, any other questions?
Yes, from Facebook, Rachel Foster Shaw asks, when will the antibodies test be available? Any time frame or date?
The antibody tests are available, but I did an interview on CNN earlier, and I could hear the person before me, and they said that there were issues now with the antibody testing. Even if it says FDA approved, it's not necessarily a legitimate test.
Right. So there are 2 things you need to know. You need to know whether the test can truly pick up the antibodies that we're looking for, and then you need to know whether having those antibodies truly means something, that it truly means that you won't get it again and that you're immune. And so the tests just aren't there yet for widespread use, and so a lot of the use right now is sort of experimental while they try to figure that out.
Okay. And they're very simple. The ones that we ordered, the county ordered, are a blood test.
Right.
And it says that if you've had the virus, and then I can't remember if it was LGG and IgG.
Yes.
So, and it was a level of immunity based on that. And it's like a pregnancy test is what everybody pretty much equated it to. You drop your blood on a stick and it tells
and it measures.
If it measures up. All right, is that it?
No, another question. What is the effectiveness of wearing a mask that's not an N95 mask?
So the purpose of wearing the mask in public, if we can get everyone to wear it, is that all these people who don't have symptoms but are carrying the virus, that then the virus goes into the mask and not out into the air or not onto you. And so by everyone wearing a mask, it really protects everyone else. For protecting yourself, there are very few instances when you would really need an N95. N95s are that higher protection, and so it prevents little particles from coming around the mask and going into your mouth and your nose. The reality is the vast majority of people will get infected from touching a surface and touching their face, not from aerosols in the air. And so N95 is not necessary out in public. It is necessary, though, if you're doing certain procedures in the hospitals.
All right. Anything else? All done? All right. Thank you so much.
All right. Thanks for having me.
Yeah, that was incredibly informative. All right. So for information about coronavirus and resources that may be very helpful during this time, if you have not yet, take your cell phone out and text Tampa Ready to 888-777. Tampa Lista for our Spanish speakers, 888-777 for real-time text information. Also, business owners, you can text Tampa Biz, B-I-Z, to 888-777, and we will be sending out information on One Tampa and other information as it becomes available. We also have our recovery hotline, and that is 1-833-TPA-INFO. 1-833-TPA-INFO. And we have Spanish speakers also available to answer questions on that number. So we are just starting to flatten this curve, but that is no time to let up. We all have to do our part, take our level of personal responsibility seriously in this, and do everything that you can to avoid transmitting or contracting this virus. Remember, I said I like to keep things simple, and I've said this from the very beginning. Just assume that you have this and conduct yourself accordingly. That's the best way to go about it. So please, please, please take those simple steps that you can. Don't get excited about the curfew. All we're saying is if you can stay at home, stay at home. That's it. Officers aren't going to be out stopping individuals unless you're gathering in large groups, and they're going to break those up. But that's it. Officers aren't going to stop you. You're not going to have any kind of paperwork. We're just asking that you stay at home as much as you possibly can. And the law enforcement officers, both the police department and the sheriff's office, they are out there to educate and encourage everyone to take those responsible steps. So you don't have to worry about any of that. So I think that is all that we have. And remember, we are all going to get through this together, even though we have to spend a little bit of time apart. So make sure you stay calm, you stay kind, you stay safe, and you stay at home. And we are going to make kindness more contagious than this virus in our community. Thank you all, and God bless.